Now, for people watching this that fit the two categories, they either have a loose-fitting denture or they have teeth that are so bad you cannot save them. They have to all be removed, but they don't want dentures. So when they go to your office, what are their options when it comes to dental implants?
Yeah, for those denture handicap people, my goal would be to get them into two implants that you could snap in and snap out their denture, because it helps to stabilize it.
Okay.
It helps it so that it doesn't float around. Not as much food will get underneath it. And it really helps it so the tongue doesn't knock it loose. I mean, all that stuff is great for 2. And if you want to go a little bit further with the snap in, snap out, you can get it on 4. You can put a bar on it. You can put 4 snaps in. But all that, now all of a sudden, instead of being implant, rocking on the tissue, now it's almost all on the implants. But what everybody wants, I mean, where I see the biggest change in people's, their satisfaction is when they start to put everything on implants, and everything is supporting on the implant, so it doesn't rock around. So what everybody wants is they want teeth that don't come out, that are fixed, that are almost identical to the teeth that you have. They're not your teeth, but they're the closest substitute for your teeth. So what everybody wants is they want teeth that don't come in and out.
Okay.
And so the bottom is usually 4 and sometimes 6, whatever we can do.
6 implants. 6
implants, okay. And then it's, you don't take them out because they're resting on the implants. Nice. And you don't have to take them out. And so it's great. And the more stability you have with the implants, the better off you are.
So on the upper, is a denture okay? Because the denture is pretty good. It already has suction on the upper. Is that correct?
Well, you might think it's okay, and then you never hear them complain. But the American Dental Association, the literature that I read, the satisfaction surveys, people hate their denture. They do. They can't eat. They don't have taste. The food gets underneath it. I mean, I see it so many times where in surveys, people don't like it. So if we can get rid of the palate, we can get rid of that plastic on the roof of their mouth,
okay,
they can enjoy their food much better.
So how many implants on the upper to give them a fixed set of teeth that don't come out?
I like to do 6.
Okay.
So you can do it in as little as 4, but I've done as many as 8.
Okay. Okay. So they could have upper and lower teeth that don't come out. How soon can they eat, and what can they eat when they're all healed up?
Well, after they go through their healing phase, they can eat everything. They can eat carrots and nuts and things that they've never been able to eat before, because the denture doesn't do it. Every denture I've ever made, I've put my fingers in there and I've asked the patient to bite as hard as they can. Usually they can put 10 pounds per square inch. I've never, in my almost 40 years of dentistry, been able to have a patient hurt my fingers when they bit down on a denture. But I can't do that once I get them fixed set of teeth. I cannot do that.
So upper and lower, now you have this model where you can get them, what takes other guys 10 months, you could take somebody with no teeth and get them in a fixed set of teeth in very few appointments.
It's incredible. That's I've stayed away from this game for a while because it's been so frustrating. I didn't like the results that were happening, and so finally somebody came up with an idea to marry all this technology and be able to, I'm proud to be able to do this, because I was struggling trying to get it done in 4, 5, 6 appointments. Now, in 2 or 3 appointments, we can get you teeth.
So if everything works out right, literally 2 appointments, they could have upper and lower teeth that don't come out.
Correct.
Is that true?
It is. It is. It boggles my mind. I never thought that I'd be able to say this. I've been in this game for a long time, and I never thought that I'd be able to say that.
If you're 80 or 90, aren't you too old? Like, won't the implants fall out? Are they more likely to fall out?
Oh, no, no. Once the implant is integrated, it's for life. It's for life.
So it doesn't matter the age, you can get this done?
It doesn't. It doesn't. People, I think there's a misconception out there.
Yeah, but what about somebody who's been wearing a denture for like 15, 20 years? Is it true? Not enough bone to get dental implants?
Oh, not true. We see patients all the time that somebody's told them that they can't get it done.
Like another dentist said, you can't do this.
Correct.
Not enough bone.
Correct. We get them bone. Within a couple of visits, they have teeth that are fixed.
That don't come in and out. So what are you doing that's different than these other guys? If they're saying you don't have enough bone, does it just come down to training, or is it technology, or both?
It's training and technology. So, I mean, everybody does what they're comfortable with. So the issue is, people don't know what they don't know. They haven't, even after they go through graduate training at university, some some of those dentists don't go for further training. Again, you have to always be going out there and trying to see what people are doing, because I mean, if somebody's doing it, it must be possible, right? So,
okay.
You know, so I was just sitting next to a dentist that she brought her surgeon to a course, and she said, well, she raised her hand and said, well, John, what if my specialist says it can't be done? And John said, get a new specialist, but her specialist was sitting right next to her.
Okay.
It was very embarrassing, she said, because he said basically...
So this is like a new shift in dentistry of the speed in which it's done.
Oh.
People that weren't candidates for dental implants, like full upper and lower teeth that don't come out, are candidates today. Is that kind of what's going on?
For sure, for sure. I mean, the profession is moving so fast in this regard. It's at lightning speed.
So no more dentures. Like, do you think that's the future of dentistry?
Oh, that would be great. It would be. There's millions of people. I mean, we could fill up Wrigley Field 10 times with the number of people that have dentures. So I've made thousands of dentures, and if I had to do it again, I wouldn't do it. I would have somehow found a way to get them onto implants, because it's such a superior way to go through life. You're more confident. It just changes your whole self-esteem.
So the thousands of people that you've helped get upper and lower dentures, if they're listening to this, watching this right now, what do you say to them?
Come on in, I'll help you.
Like at least 2 implants, snap in, snap out? Or fixed teeth?
Correct. It's a game changer. Once you put 2 implants in and you secure your denture with 2 implants, you'll be thanking me. It's a life changer.
And they can eat and chew whatever they want.
Yes.
And do they look real, these teeth?
Oh, for sure. We spend a lot of time trying to make whatever we make. We don't want you to be able to see, we don't want you to notice that you don't have teeth. That's horrible.
So they look authentic. They don't look like fake denture teeth.
They don't. Not at all.
Because you have photos on your website that show this.
Yeah.